Hi, this is Dr. Barry Leica, host of Inside Cosmetic Surgery Today, your inside source of information of cosmetic surgery. This is the only place you should come for cosmetic surgery information because it can show you things that you can't get anywhere else. Today, I'm talking to Charles Crutchfield about a procedure that has really taken the press by storm, and it's called the vampire lift. Hi, Charles.
Hi there.
How are you today?
Fine, thank you.
Fantastic. Now tell me, I've read about the vampire lift. I've never performed one, but what the heck is a vampire lift for our listeners?
Well, it's a catchy name, and the reason they call it a vampire lift is because you actually, the derivatives, the products that you use to rejuvenate the skin and cause a filling action are derived from blood, and it's usually the patient's own blood. So it's an autologous transfer, which is really slick. I tell patients it's just you helping you. And it's been around.
We've talked a lot. We've seen a lot of people getting fat taken out of their hips and injected into their lips and things like that. At least that's very commonly done these days.
Mm-hmm.
What's the difference with this, Charles?
Well, the interesting thing about the autologous fat transfers or adipocyte transfers is they're coming to realize that some of the major benefits of the transfers have to do with the stem cells that are included in the overall adipocyte transfer. And a lot of these stem cells are producing cytokines and growth factors that are having a tremendous benefit as far as rejuvenating the skin, collagen production, hyaluronic acid production, and making the skin more youthful. So it's not just the fat itself, it's some of the cells within the fat that have these kind of magical molecules. And so the theory of the autologous or the vampire lift is been around for a long time. In fact, several years ago, I was watching a Minnesota Twins baseball game, and it's really technically called a platelet-rich plasma. I was watching a Twins baseball game, and they said one of the pitchers hurt his shoulder, and they were going to have a PRP injections. And I thought, what is a PRP injection? So I looked up platelet-rich plasma. So it's been used in professional sports probably for about 10 years.
Yeah.
They take a small aliquot of blood, and they spin it down, and they concentrate and extract just platelets, which are rich in growth factors, platelets, cytokines, and growth factors. And they take that small amount, and they make teeny injections in sports into the joint to cause joint repair, collagen production, and to stabilize and improve the joint.
And that's been going on in baseball. That's been going on in hockey. It certainly has been going on in professional football for a long time.
For a long time. In fact, I sent one of my friends to an orthopedic surgeon. He hurt his knee, and I got the consult letter back, and they're going to do NSAIDs, range of motion exercises, and a series of PRP injections. So it's been well accepted. It works very well. But the company that makes the collection system thought, well, if it works well to repair the collagen in joints in athletes, what about collagen in skin? And they did a series of studies, and it got FDA approval in the United States about 2 years ago.
Yeah, I never was a big fan of fat injections. I did a series of them way back in the year 2000 or so, and I found the material, first of all, very hard to work with. It was very chunky. It was not very moldable. And second of all, it just, you had to harvest it, and you had to purify it in such a way that fat was much more harder to purify because you had to get almost all the red blood cells out of it, otherwise the body would reject it. The other thing I hated about fat is the rejection rate was so high. I mean, it was just terrible. Now, I think that's
and now they're
overcome by
coming to realize that when it's successful, it's mostly due in part to the stem cells within the fat that are producing the cytokines.
Yeah, so that's important to make sure there are stem cells and make sure they're preserved. So why not just take the stem cells themselves and the platelet-derived growth factor and really go for it?
And that's what you do. This is the shortcut. This is the shortcut. And
now, who's the ideal candidate for this vampire lift?
Well, the candidate, usually patients that need two things, and it's very interesting. Mainly we started doing this to replace volume in the nasolabial folds, on the chin and the mental lines, sometimes in the cheek and the hollows of the cheeks. So usually to improve volume. But after I started doing it, many of my patients said that the unexpected benefit and the things that their spouses noticed was how great and youthful and glowing their skin looked. So it has it's not just a filling effect, it actually changes the look and the texture of skin. It makes it much more youthful. And I'm starting to see that a lot more too. So some patients who just want to change the texture and smoothness and look of their skin, not necessarily filling. The one thing that I've also found is that when you do the injections, and it's beautiful because you only have to take a couple tubes of blood. It takes 6 minutes to spin down and about 10 to 15 minutes to inject. So the whole procedure is about a 30-minute procedure. It really is. Minimal bruising, minimal swelling. But the problem is that once you inject the growth factors and cytokines, you don't really see a large fibroblast response, collagen production, for about 2 to 3 weeks. And it crescendos at 12 to 14 weeks. So it's not a real fast process like using an immediate filler like Restylane or Juvederm or Perlane. It takes a couple months. But when it does work, when you produce your own collagen, it can last 3 to 5 years or longer. The FDA studies, they've only taken it out to 2 years. They actually can say it'll last 2 years. And that's what people are looking for, more of a longer-lasting result.
Interesting.
But the other thing that I've
Charles,
noticed, too, is that
is this going to replace Restylane? Is this going to replace Juvederm? Is it going to replace Sculptra or any of those?
Not at all. They complement each other, and I think when you have a real cosmetic artist, physician working with you, then they can blend all of these things. It's just another tool in the toolbox. One of the things that I found, and I saw this actually today in a patient, she needed a lot of volume replacement, probably 2 to 3 cc's per nasolabial line per mental crease. So she could have easily used 12 cc's of Restylane, which is a significant amount. Mm-hmm. We did Selphyl for her, and she came back. It's been 3 months, and she said, I don't really see a whole lot of filling effect. And I said, sometimes you'll get a partial response. In my experience, about 40 to 50% of the time, you get a complete response, and you look at it and it just looks great. But about half the time, you'll get a partial response. And so when you do supplement with a little Restylane, it's only half as much. We used only a total of 3 cc's of Restylane for her full face, and it filled in completely, only because the Selphyl had built such a strong base. Yeah. I barely pushed a little bit in, and it filled right in. It looked magnificent. So I use it to supplement. It's more cost-effective. If you look at the price of 12 cc's of Restylane versus 2 cc's of Restylane and a Selphyl, it's about half the price. So once again, it also has significant savings for the patient.
Well, that's huge because, people, there's nothing better than Restylane and Juvederm and these materials, but some people need so much of them it becomes cost prohibitive.
And that's another advantage of this system. Even though it's not free, it's only, when you look at it with respect to the volume it fills, it's only about 1/3 to 1/2 the cost of those other ones.
Well, that's huge. That's huge. Now, are there any downsides to this treatment, Charles? Because, we always like to talk about the positives. You and I, we always augment the positives, but there's always a downside as well in everything we do. What would be the downside of this procedure?
I think that the downside, although I would stress the upside, is it's all natural. We're not adding anything exogenous, nothing synthetic, nothing from the outside. Like I tell patients, it's just you helping you. We're taking your own growth factors and cytokines and concentrating them, putting back to work in the spots they need them to work in. So in that respect, it's great. That's the big upside. It's a very there's nothing more natural than this. This is it. This is just you naturally helping you. But the downside is, like I said, it doesn't work immediately like Restylane. It can take 2 to 4 weeks to start working, and it might even take 2 to 4 months to fill in completely. So it's not a fast treatment.
Now, does this work better in younger people versus older?
I've seen it work in all people. I've probably done maybe 200-300 cases, but I haven't done enough to see if there's a significant difference in age. I see it working in all age groups. Because
one thing I do find as we do some of the fillers in older people, like Sculptra and some of those, they just don't take as well. That substance isn't there to build the skin back. The skin isn't just as nice. It's not as hardy as it used to be. And I find that a bit of a downside of using some of these agents in older people.
Well, I think that maybe is an upside, because that's one of the few comments that I've heard from patients without solicitation, that the people around them, including their spouses, are saying how nice their skin looks. It just has a different appearance, a more youthful appearance.
No, I think that's because cells communicate with each other, Charles. Without a doubt, I think there's a communication network that we haven't totally tapped into and we don't totally understand. But I think there's more and more of that that's going to come to life over the next couple of years as we understand those communication channels that go on.
Yes. I think the other downside would be, like I said, if you're expecting a total and complete response, you'll get a total and complete response 30 to 50% of the time. But about half the time, you're going to get a solid but partial response, and you're going to have to still come back and supplement with a different filling agent. But the advantage with that is you only have to use 1/4 to maybe half as much.
Now,
so that's the other
doubt. Any people at all with no response?
It's difficult to say, not really, because the ones that have had a response, like the woman today, she came back and she said, "Oh, I don't think it worked at all." And when I started to push in a little bit of wrestling, I just put in a few drops. It filled up completely. I realized she had a really strong base, and I was just topping it off.
Yeah.
So the difficulty that we have, and I talked to a patient about this the other day. She said, "I want to do some wrestling to fill these lines in, but I only want to use 1/2 of a syringe." And I said, "Well, you're going to need a full syringe." She said, "Well, I just want to use half a syringe." And I said, "The problem is, and this is a bad analogy, but if you're trying to make a bucket look full, like it's full with water, and so the top looks nice and full and smooth, you can't put in half a bucket's worth of water. You have to put in a full bucket. Otherwise, it won't look full."
Yeah.
And so
that's the problem I think
you have
we
to put in the right amount.
Yeah, I think as we get older, Charles, I think the problem is the skin normally drapes over top of the deeper structures, and it's hard to tell exactly how much volume they need.
Absolutely.
I find that's more of a problem. Even the bones of the skin start to get smaller and stuff. So it's very challenging to tell how much exactly they've lost.
And I've had some patients where I'll push in a little bit of wrestling, and it fills it up completely. And wow. And I'll have other ones, and I'll push it in and say, "Where did it go?" Mm-hmm. I'm sure you've had the same experience.
Absolutely, and it just drives me nuts because, I'm supposed to be the expert. People come to me from far and wide because I'm the expert in the skin, and yet I'm always humbled by this sort of thing.
And so it's what we try to do is we tell patients a range. And I say, "Listen, we'll try this today, but we might have to add a little bit more in a month or so. So let's try this now," and easy does it. It's easier to add a little bit more than to try to put in too much.
Now, would you ever use Juvederm first and the Vampire Lift second?
Yes, I've done that when patients say, "Listen, I need some immediate filling. However, I want my skin to look more youthful and glow and look better as far as texture and overall appearance." And I'll combine the two because I know that Juvederm or Restylane will give me the immediate filling, and that the Selphyl, which is also known as the Vampire Lift, the Selphyl, a platelet-rich plasma, autologous platelet-rich plasma injections, will make the skin look better, and that happens over 2 to 6 weeks.
Excellent. Well, a couple of years ago, when I was at the American Academy of Dermatology, I went to a lecture on acne scar correction. And there was an expert from, I believe, New Zealand there who showed that you can actually take people's blood without spinning it, inject it into the face, and then use a laser to break it down and cause a similar effect. Have you ever heard of that?
I've heard of variations. In fact, we use Selphyl to treat acne scars, and I do a 2-step process, actually 3 steps. I'll first do Selphyl to inject the acne scars, and what that does is that primes all the fibroblasts and gets them producing collagen. And then 1 month out, I do a series of saline injections into the same areas. And what happens is saline causes pressure on the already primed fibroblasts, and they start producing even more collagen. And saline is relatively expensive, so we do a series of monthly saline injections, anywhere from 2 to 8 treatments, and we're having remarkable results.
Yeah, and that's a great way to get some of this. The big problem with acne scars is there's usually a lot of volume that needs to be done there. So it's nice to be able to prime the body's own complexes and make it look natural.
Yes, and then like I said, saline is relatively inexpensive, and it keeps the production going. And we've had some of my most grateful and thankful patients in the last year doing this program of both Selphyl and saline injections for acne.
Does it work on the other areas of the body, like scars on the back or anything like that?
It works. I haven't used it for any depressed scars. Usually the scars on the rest of the body I'm dealing with are hypertrophic or keloidal. And if it's a mild depression on a scar, in the past, traditionally I've used a filling agent like Juvederm or Perlane or Restylane. That tends to work well. But I layer it. I put a little bit in every month for 2 to 4 months, and I think patients get a very nice response. But I certainly wouldn't be adverse to using it in those situations.
So let's walk through a treatment for a patient, Charles, so that a person knows exactly what to expect in a treatment like this.
Well, let's say that we're going to be treating the lower half of the face just for volume correction and for overall rejuvenation. So the patient will come in, and there are 2 different sizes. We can either use 4 cc's or 8 cc's. And so we'll have one of the nursing staff draw their blood. We have a special centrifuge and a collection system to spin it down. The spinning cycle itself only takes 6 minutes. And then from that, We have special syringes to just draw up the concentrated platelets and growth factors. It's kind of a little serum band, and we end up with anywhere from 4 to 8 cc's of material. I use the same injection size needle that I use for Botox, and we make dermal injections into the skin, little dots, and we massage it in. So the injection itself takes about 5 to 10 minutes. We use a nice numbing cream on the skin, so it's fairly comfortable. And then after the injections, we use gauze, and we just massage it in gently for about 5 minutes. So the overall procedure, from withdrawal to spinning to injection, takes about 30 minutes.
That sounds good.
If patients are really anxious, we'll give them a little Valium and make sure they have a driver. But I'd say that's the minority of cases. The vast majority of patients do just fine.
Do any patients have a risk of infection with something like this? The biggest worry I have with using people's own materials is that somehow some bacteria gets into the system. You know, that blood is a great thing to grow bacteria. I mean, just a couple of little particles in there and it can blow up.
Nope, it's an absolutely complete closed and sterile system, and that's the beauty of it. Everything is sterile.
Yeah, and I think that's something we have to tell our clients about because they have those same fears. I mean, they've heard of blood infections and they've heard of these other things as well.
Yep, and you know, the surface of the skin is loaded with bacteria, but we cleanse and cleanse the skin both with saline and also alcohol to make it as sterile, as clean as possible. But anytime you interrupt the integrity of the skin, you run the risk of bruising and bleeding, swelling, infection, discoloration, and scarring. We let all of our patients know that, just like giving blood out of your arm. There's a small risk you can get an infection there, and once in a blue moon it happens. But when it does, we deal with it. We make sure the patients call us right away if they're having any concerns or any side effects.
So how many of these procedures are you doing compared with the traditional procedures of using Juvederm or Restylane?
I think right now still the hyaluronic acid fillers are king. I'm probably doing probably an 8 or 9 to 1 use as far as filling agents. So, but every day, I mean today, I probably did 7 or 8 or 9 Restylane injections and maybe 1 or 2 Selphyl. So that's pretty typical.
Yeah, I think that's the thing about this is probably going to gain more and more credence with patients over the years. And I think this is going to be something that's going to grow more and more. Do you not?
I do, and I think also it serves, there's a certain population of patients that for whatever multiple reasons, they're really adverse to putting anything foreign into their body or anything even synthetic, although we know that hyaluronic acid is a normal component of the skin and of the fluid in the joint and eyes. People still don't want anything exogenous or synthetic injected into their skin. So this is such a nice alternative. I have a group of patients that just welcome this because they don't want to do Botox, they don't want to do hyaluronic acid that's synthesized, but this is just their own growth factors and cytokines that they've made themselves that they can rearrange and put in areas to put to work for them. And they love that idea.
Yeah, and that's huge. I think that this fits in with a group of people that like something a little bit modern, but at the same time it's very conservative. And thirdly, it also fits in with that group of people that want everything natural.
Exactly. And you know what my patients say? How come my other doctors never told me about this? And I say, well, because it's fairly new and we're on the leading edge here.
And that's what I think the key with a radio show like this is. It keeps people abreast of these new things. I think more people will walk into doctors' offices and ask about this. And I think that's what the good of a show like this is. It helps to stimulate conversation. It also helps to get people aware of the pros and cons of doing things as well.
Yes. And once again, it goes by many names. Kind of the popular name has been called the vampire lift, but the term I use a lot is called platelet-rich plasma treatments.
Yeah, and I think that's a better term, and I'm sorry if I've confused
the
audience.
Everybody knows it. That you can do a Google on vampire, and you'll probably get 1 million pages that come up.
Whereas if you did the platelet-derived growth factor, you probably would get a lot of sports injuries.
But a lot of it is sports. Yeah, you're right.
And there's nothing wrong with that because eventually you'll get led to that. But as I say, it's nice that there's interchange between the fields now. You know, the things that are happening in sports are also happening in cosmetic surgery as well.
Right. When I was a graduate student, one of my advisors used to say, in life people usually will stumble over the truth. Unfortunately, most people pick themselves up and keep on going. Well, here's one where somebody said, whoa, wait a minute, this causes collagen production and repair in the joints. I wonder what happens in the skin. So they didn't keep on going. They picked themselves up and took a long, hard look at it, and it worked out well.
Well, it's the truth of many things. With the recent passing of Steve Jobs, I think people are saying, well, there's a guy that looked at things differently. But what he really did was took common ideas and really expanded on them a little bit more and kept on after them, because that's what truly was his genius, is he took common things and made them better.
Yeah, he did, and we're all better for it.
Yeah, and no doubt about that. And that's what I'm hoping more and more procedures like this will do. Not only can we do things painlessly, we can do things longer acting, we can do things in such a way that they look more natural. Because I think most people want more natural things in this day and age. They don't want to look plastic. They don't want to look phony. They just want to look better.
That's right. That's right. And it gives us just another tool for our toolbox to serve our patients better and get them the results that they want.
Well, I think that's huge. And Charles, again, I'd like to thank you for your participation tonight. I'm sure some of our listeners would like to get in touch with you and find out a little bit more. What's the best way for them to do so?
I think the best way is just to take a look at our website. It's Crutchfield, like a crutch in a field with a C, crutchfielddermatology.com.
And is there a phone number you'd like to share, Charles?
Yeah, they can call our office. It's area code 651-209-3600. And once again, if you don't remember that, crutchfielddermatology.com.
Excellent. Thank you, Charles. This is Dr. Barry Leica, host of Inside Cosmetic Surgery Today, talking to you about the Vampire Lift, one of the newest means of cosmetic surgery today. I hope this served you. Thanks. Have a good day.